Welcome everybody. This is a great case of an iStent inject after cataract surgery. So I'll show you a case of an underimplant that happened. First and foremost, for the cataract surgeon, it is very important to identify the structures, and gonioscopy 101, identify the scleral spur, then the trabecular meshwork. With that, you'll be very successful in finding your way. So here we see the first implantation. Here we hear the click and then the charge. And if you look at it, although there's bleeding, which means that it is within the trabecular meshwork, it wasn't really implanted where we wanted it to be. So what we do right now is just proceed as usual. We will implant the second stent. Here I'm looking for the other collector. And here we'll aim the trocar to the trabecular meshwork. And I have to apologize because that bubble right now will move right in front of the implantation. But here we indent, we'll see the V. So I apply a little bit more pressure, not over pressure, and then we'll see a nice implantation right here on the right. And here we confirm that the left stent was under implanted. So what we do is we'll use the previous charge. We have two more charges within the injector. I'll expose the trocar, and what we do now is we thread or we pass the trocar inside of the stent very slowly, carefully, and now I push in, I indent with a little bit more strength but not too much strength, and once again we have the bubbles. Today was bubble day, but once we clear the bubbles we see that the stent is nice and firmly nested within the Schlemm's canal, and the neck is surrounded by the trabecular meshwork. So it ended up being a perfect implantation of these two stents, and therefore I consider that now a successful surgery. So here we see a very nice image of both stents, and now we'll proceed to demonstrating the collector vessels, and here we see the BSS going through the episcleral vessels, and here in slow motion. So this was a great case. Thank you very much for watching. See you next time.